Hi, everyone. Gabby here, owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I wanted to jump on really quick and say hi. I also am making this video for parents or loved ones who may be questioning, does my child have an eating disorder? Well, what is an eating disorder? An eating disorder is a mental health condition characterized by an unhealthy relationship with food, body image, and or weight. The most common types first is binge eating disorder. This is where someone has episodes of consuming large amounts of food in really short periods of time, often followed by guilt or shame, sadness, depression, and there are no compensatory behaviors present. There's also bulimia nervosa, which is also episodes of binge eating disorder, followed by purging. That could be vomiting, excessive exercise, misuse of laxatives, diet pills, so some sense of compensatory behaviors. There's anorexia nervosa, which is where someone restricts their caloric intake. There's an intense fear around gaining weight and often distorted body image also associated with that. Then there is ARFID, avoidant restrictive food intake disorder. This was previously sought as picky eating, but it is much more than that. Then there is orthorexia, which is not in the DSM. Orthorexia has a lot to do with obsessions around health and food being pure, excessive exercise, a lot of focus on social media as well as fitness, but it's not limited to just that. And also disordered eating, which maybe isn't where as severe as an eating disorder, but where your child or loved one may have a distorted or unhealthy relationship with food and or their body. There are other types of eating disorders, such as rumination disorder, also referred to as chewing and spitting. There is pica, which is where people eat objects or things that are not food, as well as night eating syndrome. And this is where people eat at night, and it's not caused by a medication related symptom or something to do with malnutrition. So that's some of our eating disorders, or most of the eating disorders in a nutshell. Um, so what to watch for? Well, there's a lot of things to watch for because eating disorders, disordered eating, it's complex and pervasive and hard. And if your child is struggling, I'm just sending you so much compassion right now. But some signs to watch for um, is changes in your child's eating habits. Did they used to like certain things and now they're avoiding them? Did they start eating excessive amounts of one particular food that they're focused on? Have they started being sensitive around textures or smells or the sensory piece of food? Um, are they skipping meals, reducing portions, growing portions in a way that doesn't feel typical for them? Are they eating in secret? Are they hiding food? Also, are they frequently talking about diets? Are they obsessed with weights, calories, numbers? Are they preoccupied with fitness and like being strong? Or are they constantly looking in the mirror and checking their body, checking their appearance? Have you seen, noticeable weight loss or weight gain? Although, just to be clear, eating disorders are not about a size. Any size body can have an eating disorder, just to be clear. But are you noticing a change in your child's body that's not typical with kind of where they're at or what's normal for them? You know your child, you're their parent, you're their loved one, you know them. Um, are they excessively tired? Are they withdrawing from friends? Are you seeing changes in their hair, skin, and nails? Um, are they more moody? Like I said, avoiding social events, irritable. Now, some of that is puberty or, young adulthood, right? Some of that could be a sign. Again, you know your child best. Um, are they secretive after meals? Are they disappearing to the bathroom? Are they running the water constantly while they're in the bathroom for excessive periods of time? Are they, again, excessively exercising or cutting their food into small pieces? These are all just things that come to mind as an expert to look out for. Um, And what can you do? So, being their parent, you can do a lot, which is awesome. You are their safe person. You are their support system. You are their access to care. So, I think the first thing is know the signs. You're here, you're learning, you're reading the blog that we're going to attach to this video, as well as other resources. You're doing all the things. Great job, mom and dad. Um, what else you can do besides educate yourself is be their safe space, right? Create an environment for them that they can come to you. Also, try to approach conversations with them around food and body neutrally. Let's be curious, not critical. I'm sure you're feeling scared and worried, and that's totally valid. And if we want our kids to come to us, again, we have to be their safe space. So we can't let our feelings about what's going on get in the way. If you're struggling with that, there is help for you too. So besides education, creating that safe space and support, proceeding curiously, not critically, and making sure to just stay neutral. You can provide them resources such as therapy, nutritional services, speaking with their primary care, a psychiatrist if that is needed, as well as support groups. Just so you know, there are not particular causes for eating disorders. There's not one cause. You did not cause this. There's psychological factors, sociocultural factors, genetics, life transitions. There's not one cause of an eating disorder. And I just want to say again that this is not your fault. So know the causes as well as the symptoms and the signs and symptoms. And then lastly, um, get them the help they need. An ounce of prevention goes so much further than intervention. So if you're sitting here and you're like, well, they don't have an eating disorder, but they might have disordered eating, that's a great time to get services started, whether it's with us at Recovered and Restored or it's with a practice that's close to you. I highly recommend getting your child the help they need. It can be life-saving. If you are struggling to find care for your child, please don't hesitate to reach out. You can reach out to me through our website at recoveredandrestoredtherapy.com. You also can email me directly, Gabby at recoveredandrestoredtherapy.com. And yeah, if things are coming up for you or your child as you navigate this journey, please don't hesitate to reach out. Just a quick note, this is not a supplement for therapy. It is meant to help you along your journey and encourage you and your child along the way. And I will say this, eating disorders, although complex and scary, are very much something that your child can heal from. Healing is possible. I hope this helps. Bye, everyone.